Hi guys, welcome back to my channel. So today we're going to be discussing syndrome of inappropriate secretion of antidiuretic hormones, SIADH. A good way that I remember it is syndrome of increased secretion of antidiuretic hormone, because that helps you to remember it a little bit easier. Now, as you know, this is a disorder of the posterior pituitary gland. Now, one of the hormones that's stored and released by the posterior pituitary gland is that antidiuretic hormone, and it's also known as vasopressin. We discussed this previously. Anti means against, and diuresis means increased urine output. Therefore, this hormone, antidiuretic hormone, usually works against diuresis, and it does this to help regulate fluid levels in the body. Now, SIADH occurs when there is too much ADH in the body. Now, this leads to decreased urine output. So some of the causes include head traumas, tumors, meningitis, and even some medications can cause or contribute to this condition. Big signs and symptoms to remember for your exam. As you know, antidiuresis already works against diuresis, so when there's too much of it, it's going to cause the body to retain too much fluid, and so you will see oliguria, which means decreased urine output. And with decreased urine output, the urine is going to be more concentrated, so we're going to see increased urine-specific gravity. Now, when the urine is more concentrated, we also see increased urine osmolality. Now, remember, we're retaining so much water in the body, so our blood is going to be a lot more diluted, right? Because there's too much water, and the electrolytes are going to be diluted as well. So you might see some of those blood levels will be lower, but a big thing to remember for electrolytes is that you might also see hyponatremia, because it's diluting too much of that sodium in the body. So accompanying hyponatremia usually comes confusion, irritability, seizures. So you need to note this in your patients, because if you see this, you know you need to put these patients on seizure precautions if they're hyponatremic, and monitor for all the risk of falls and all the things that can come from confusion and irritability. Now, also with retaining all that fluid, we might see some weight gain, weakness, anorexia, and then nausea and vomiting as well. The diagnosis is usually typically made by CT MRI of the hypothalamus and the pituitary, or sometimes a 24-hour urine collection to assess that urine osmolality also aids diagnosis. As the nurse, we're going to restrict fluids because they're already holding on to a lot of fluid. So this patient might be on a 500 to 1,000 milliliters per day fluid restriction. It's your job to keep an eye on the patient's INOs, their intake and output. How much are they eating? How much are they drinking? And how much are they putting out when it comes to liquids throughout the day? You're going to weigh these patients daily, because increased weight continuously might tell us that they're taking in too much fluid than they should be. Monitor their mental status, because we talked about hyponatremia and how it can cause confusion, irritability, and seizures. Of course, you put them on those seizure precautions, and you monitor their blood pressure, because when you retain too much fluid in the body, it can cause increased blood pressure, and it can also cause increased heart rate, and it can also disturb those fluid and electrolyte levels. Now, you may expect to administer medications like a hypertonic saline solution. You might give a loop diuretic to help them pee out some more, or you may give conivaptan, which is a vasopressin antagonist. So this is going to help to work against ADH and help to normalize some of the urine output and other things that are going on in the body. So this is the end of this topic. If you have any questions, make sure you leave them in the comments below. Don't forget to subscribe to this channel. Don't forget to turn on your notifications so you know when a new video is up. And also, don't forget to leave me a comment and share this video to people you think might benefit from it. As always, thank you for being here. I hope that you look out for the next video. I look forward to seeing you then. Bye-bye.